Hello guys, welcome to another episode of OPD series, part 6. Here we will be discussing about how we can measure an airway obstruction. This session will be starting off with a case study. So, a patient, a 30-year-old male patient presents with the complaint of breathlessness since 1 week, and his breathlessness get aggravated during the night time and in the presence of dust or cold. And there is a past history of similar episodes. On examination, he was having bilateral Bs. His BP, pulse, blood examination, and everything was in the normal range. I treated the patient with nebulization on salbutamol and budecort. The post nebulization, he was symptomatically better, and for some reason, I did a spirometry before nebulization, and the result of the spirometry was as such. The spirometry, it almost gave a scooped up figure. So the patient was having breathlessness on which aggravated on night times and during dust or cold. It was almost like the patient was having allergic reaction. Chest examination, he was having bilateral Bs, and even he has past history of similar episodes. The spirometry I have done was given a unique figure also. So how will you measure a patient's obstruction, or how will you determine what kind of disease a patient has based on spirometry? See, this is how you make a patient do the spirometry. You can see the device. You ask the patient to inhale fully, then blow out as hard and fast as they can into the spirometer. Here we'll be measuring the maximum forced expiration. First, the FEV1, that is a forced expiration expiratory volume in the first second, volume of the exhaled air in the first second, and FVC, forced vital capacity, is the total volume that we exhale. So it will be measuring two volumes, forced expiratory volume in the first second and the forced vital capacity, and we calculate the ratio FPV1 by FVC. We have to determine what ratio is coming. Is it less than 70% or is it more than 70%? What happens if it is less than 70% or more than 70%? What kind of conditions are included under it? See, if the FEV1 by FEC, the ratio is less than 70%, it is obstructive diseases. And if it is almost normal, it is restrictive. See, in FEV1, if it is obstructive, so what we are exhaling out in the first second will be less than what the total volume we have exhaled. So the ratio will be less than 70% and we can calculate it as obstructive. But in a restrictive disease, that means if the chest wall and everything is not moving, there will be a proportional decrease in both FEV1 and FVC. So the ratio will be almost normal and it is restrictive. The example you can give an obstructive disease will be COPD, asthma, etc. In a restricted disease, you can give it as myasthenia, this lung fibrosis, massive pleural effusion, etc. Here I have given you three images of the spirometry, where the first image is shown tracheal obstruction. Second is COPD or asthma, which is almost similar to the case study we have presented. And third one, which has reduced overall, belongs to restrictive lung diseases. So in a case with FE1 is less than 70%, that means it is an obstructive lung disease, mainly asthma or COPD. So in these two conditions, the patients come to you and they have breathlessness, and you have done a spirometry, and you have to treat the patient. You will be giving them a short-acting beta agonist. After giving the beta agonist, there will be an increase of more than 12% or more than 200 ml in FeV1 or FeC. That means that kind of disease is reversible. If the reversibility is greater and there is a large improvement in FeV1 and variability in the peak flow over time, these are actually features of asthma. So you need to calculate the spirometry before and after nebulization to see if it is reversible or not. If it is reversible and is fulfilling the criteria, we can say it has features of asthma. Thank you.